You're listening to The Scope, a podcast dedicated to having open conversations about healthcare topics relevant to our patients and community. Today, we're talking about high blood pressure. Let's get started. Hi, my name is Paul Hackbarth, and I will be co-hosting the Scope podcast with Paige Heidman moving forward. I'm very excited to be here today. Our guest today is Dr. Fawad Virk, an interventional cardiologist with the Phelps Health Medical Group. Welcome to the show, Dr. Burke.
Well, thank you, Paul. Thank you for having me today.
Yeah, we're so glad you could join us here. So to kick us off, since this is your first time on our podcast, why don't you tell us and the audience a little bit about yourself?
Yeah, sure, absolutely. So as many of you now know that it's been almost a month I have joined Phelps Health as an interventional cardiologist. I'm excited, obviously. I've just moved from Texas and with my family and my wife and my 4-year-old. And as a profession, obviously, you know, I'm an interventional cardiologist, and I'm also a general cardiologist. You do a bit of everything. That includes putting a stent in your heart and check your pressures, blood pressures, and also check for heart failure and other common problems for the heart. So I'm very excited to be here and to serve this community.
All right, awesome. So that's great. Well, once again, we're glad you're here at Phelps Health, and we're glad you're part of the cardiology team here. So let's jump right into today's topic, high blood pressure, or sometimes it's called hypertension.
Sure.
This is a topic, actually, I'm specifically interested to learn more about because I have high blood pressure, so I'm excited to learn what we can learn about this today. So tell me, let's start what exactly is high blood pressure or hypertension?
Yeah, so, you know, this is a very common problem. Not in the United States, actually, all over the world. And every year, the numbers are going up and up slowly. So basically, what is blood pressure? You know, it is a pressure inside your arteries that is generated by the heart to keep the blood running around your body, okay? And there's always a certain pressure that is good to keep that blood running. But if that pressure is higher than normal, and if it stays higher for a long period of time, then we eventually label that patient as hypertension or high blood pressure.
Okay, that makes a lot of sense. So are there different stages of blood pressure? Can you kind of talk a little bit about what are the different stages of blood pressure and what are those numbers associated with? Yeah,
so, you know, recent guidelines in 2017, there are new data that came out that they have changed the numbers and definition of the high blood pressure. So there are different stages, which ACC, American College of Cardiology, and American Heart Association that came up with those numbers. So the normal blood pressure is less than 120/80. Okay, and once your blood pressure is more than that, if your blood pressure is more than 120/80, that's called elevated blood pressure. That's the time usually when you start telling your patients that your blood pressure is probably going towards a little high. Maybe we need to talk about your lifestyle modification. But once your blood pressure goes above 130, so 130 to 139, and lower pressure from 80 to 89, that's called stage 1 hypertension. And if your blood pressure goes above 140 over above 90, that's called stage 2 hypertension. So the more above, if you're in stage 1, you probably have to take either one pill or no pill or with lifestyle modification. If you're not able to control that, we can put them on a pill. But if you're in the stage 2 and above, I think then that's the point. We really have to be more aggressive to prevent any future heart attack, stroke, or heart failure, or any problem with the tear in your aorta.
Okay, so I want to go back to something you said. You talked about systolic blood pressure. When I see those numbers for high blood pressure, there's usually a high number and a low number. Can you kind of explain to that? I think there's like it's called a systolic and diastolic. Can you explain the difference between those?
So systolic is what you call it upper number usually. So when your heart is pumping, and then that's the pressure you are generating when the heart is pumping, we call it, the upper number is called systolic. And then when your heart is relaxing, you still have to have some kind of pressure inside your heart arteries and inside your heart, and we call it diastolic when the heart is most relaxed. So systolic upper number, diastolic lower number when heart is compressing and when heart is relaxing.
Okay, that makes a lot of sense. Awesome. So, and then also, can a person's blood pressure kind of vary or change throughout the day? I mean, it's not always constant, is it?
Yeah. Yeah, no, absolutely. You know, it varies from morning, noon till evening, and it's a rhythm that happens. So it depends on the time of the day. Your blood pressure can be very, you're working, you are under stress. Yeah, your blood pressure is going to be high. You wake up in the morning when you're more relaxed, your blood pressure might be low. And when you go back to sleep at nighttime, in your healthy state, if your arteries, your heart is healthy, your blood pressure is supposed to drop down. So this can vary according to the day, according to your stress environment, and what are you doing? You're sleeping, you're doing some work, you're drinking coffee, and all that stuff. So your blood pressure keeps changing throughout the day.
Okay, so that kind of makes sense when you change your or when you check your blood pressure, it may vary throughout the day. So alrighty. So we were talking about high blood pressure. Is there a thing such as low blood pressure? Can your blood pressure be too low? Is that common? Is it not?
Yeah. So it's not that much common to have somebody like walking with a low blood pressure, but yes, there is a thing called low blood pressure, which is called hypotension. That usually they define it as if your blood pressure is less than 90 systolic over less than 60 diastolic. You can call it as hypotension or low blood pressure, but this is a relative definition because everybody is different. Some people do feel some symptoms because of the low blood pressure, which we call it, and some people this is normal for them. Okay. It's in young population, young patients, and my blood pressure remains in 90s over 60s. Okay. So, and I'm like walking, doing my stuff. So that could be the normal for someone, but for some other people, it can be hypotension or low blood pressure. And that can happen for multiple reasons. You can have dehydration is a common reason. Patients can have cardiac conditions that can have low blood pressure. We call it sometimes cardiogenic shock. If you have some infection going on in there and it goes into blood, so those patients are obviously in the hospital in ICU level care. But some people just walk around with that blood pressure, and if you are not feeling anything, there's nothing much to do. Lower is better.
Yeah, so that's great. So it sounds like it's very individualized.
Yes,
there's not a one size fits all for high blood pressure. So alrighty, so let's talk a little bit about what are some of the causes of high blood pressure. What causes your blood pressure to go high?
So there are multiple things that can cause high blood pressure. We call it a primary hypertension or secondary hypertension. So primary means that we don't really know the cause. That means there's a lot of factors, including genetic factors, including environmental factors. That includes your diet, your exercise, your weight, your smoking, all these things that can contribute eventually the thickening and hardening of the blood vessels, and then eventually you can have high blood pressures. Secondary hypertension is the one where there is some specific cause we try to find out. That could be a lot of reasons actually. There are some tumors, there's some endocrine problem, the thyroid problems. Patients can have high blood. There can be a blockage inside the kidney arteries that can cause this. There may be some blockage in the big aorta that can cause this. So there are a lot of reasons when that can cause high blood pressure, which we usually call it secondary hypertension.
Okay, so I didn't know about the difference. So that's interesting to know. So, alrighty, you kind of mentioned this earlier, but can you talk a little bit about the risk factors that lead to high blood pressure? What are the more common risk factors for high blood pressure?
So there are certain risk factors that you cannot change. That includes your body genes. Yeah, you got it from your family. There are a lot of polymorphic genes, they call it, that there's no single gene that you can identify that you inherit. So if you have a family history, then obviously you have a risk for high blood pressure too. And unfortunately, you cannot change that. So that's one of the risk factors. But slowly, when you grow older, your heart arteries can get more stiffened and you can have slowly high blood pressure. Unfortunately, you can change that. You've got to age, okay? But there are certain modifiable risk factors that can actually help that are risk factors, and then as a clinician, we focus on those risk factors to reduce the happening of the blood pressure and to control that. That includes weight. If you're overweight, that's the biggest risk factors, especially if you have underlying sleep apnea. Patients can poor diet. They are eating salt, And then again, the salt doesn't have to be the actual salt you're putting. It all the canned food you get from any place out there, or if you're eating a lot of food from outside the fast food, so that can raise your obviously blood pressure. If you're not eating enough vegetables, low potassium diet, that can cause actually high blood pressure. If you're smoking, that's also a biggest problem that can eventually cause heart problems and including high blood pressure. If you're not doing enough exercise, you're not conditioning your body to that, so that can eventually lead your weight gain and eventually one of the risk factors that can actually cause high blood pressure. So a lot of stuff you got to watch in those patients, especially if you have diabetes on top of that, and if you have a kidney problem. So if your kidneys are not working fine, you might have a blood pressure problem on top of that too.
Okay, so it sounds like it can lead to a lot of different health issues. Yes. So that's that's not very good. So, alrighty. When we talk about high blood pressure, are there any symptoms that people might have if they have high blood pressure? And if so, what would those be? Yeah,
that's a good question. Sometimes I hate to use that word. It's called like silent killer. That's the thing. Sometimes you don't even know, and eventually one day. I have a lot of patients, they went to the Walmart and they just randomly they checked their blood pressure, or they went to some county fair and they were checking health and they just found it incidentally, or they went to their primary care doctor just for a regular visit and they noticed that the blood pressure is high, and patients don't have any symptoms. As compared to if your blood pressure remains too high for a long time, then patients start feeling symptoms. If it's too high, that I'm talking about more than 180 or 200, and some people actually live on that blood pressure too, they can have headaches, headaches, they can have visual problems, they can see some floaters on their eyes. Patients eventually starts having chest pain or shortness of breath because it's putting a lot of stress on your heart, and your heart actually tells you that, hey, there's something going on wrong and your blood pressure is probably too high that's causing this. Sometimes they eventually they can have a swelling in their legs on top of that too. And if there's any, as I mentioned, if there's any secondary hypertension, that if there's any thyroid problem, you can have a lot of other problems on top of that too that can lead to high blood pressure. So it depends on what's the cause, but most of the time the primary hypertension is you don't have any symptoms. So that's where the important part is, that you have to have your regular visits, especially when you're getting older, above age 35 especially, and if you have a family history especially, have your follow-up with your primary care doctors. So that they can yearly regular exam, and that's how they sometimes catch that your blood pressure has been high. So definitely there's something to keep an eye on it.
Okay, yeah, that makes sense. So I know sometimes when I'll go to the doctor, my blood pressure will end up being high, and they'll ask like, "Is everything okay? And I said, for the most part, I feel fine. I don't really notice that. So, it can be a little different like that. So, but okay. You talked a little about this earlier, but can we go back and talk a little bit about more what happens to your body during high blood pressure? What are the things going on inside maybe your heart, your circulatory system?
So when your pressure is too high within the system, it's just like, if you ask some plumber, he will tell you that all those plumbing pipes, and in winters you have burst of the pipe, right? This is the same, you have all those blood vessels, these are pipe, and your heart is actually pumping that blood into those pipes, which are blood vessels. So if you have a constantly elevated blood pressure, it eventually starts affecting, number one, your heart, okay? You start developing congestive heart failure. Okay, and then start heart getting stiffer, because heart has to push a lot of blood against a lot of pressure above there. So eventually you're gonna have heart problems. In your arteries, if you don't take care of the blood pressure, we call it aortic dissection. You can have a tear inside your big aorta. If your blood pressure remains high, then people can have a stroke, or they can have a hemorrhage in the brain. Kidney problems. You can end up with a kidney failure with that. Patients end up on the dialysis if they have uncontrolled high blood pressure for a long time, and especially on top of the diabetes. So these are the things that actually blood pressure slowly over the years that eventually affect your body organs and then you end up with a kidney failure or heart failure or a stroke or aortic dissection, and a lot of problem down the road.
Okay, so that it just goes back to the importance of making sure of maintaining your blood pressure, watching that, and getting that checked on a regular basis. So it can lead to a lot of different problems. So, alrighty. I also want to talk a little about what is the difference between so blood pressure is the thing that they check with the cuff and the arm cuff, but then people also talk about maybe your pulse or heart rate. Are those things similar, the same, or are they different? Can you kind of explain a little bit?
They are different things, So heart rate or pulse is the thing. How many times in a minute your heart is beating? Okay, so if we call it heart rate or pulse rate, and that's when your heart beats, the pressure it generates, it's a blood pressure. Okay, so these are two different entities. These are two different things. Pulse is the beating of the heart in a minute we calculate, which normally people have it from 60 to 100 beats per minute. And the blood pressure is obviously a pressure inside your arteries that is generated by your heart. Okay.
Is there any correlation or connection between the two?
No, not really. If you have a high heart rate, if you have a low heart rate, there can be a correlation. Yes, because because when your heart is beating, that's how it generates your blood pressure though. But if you have a fast heartbeat, that does not mean that you're going to have a high blood pressure too.
Okay. All right. So that's good to know. So alrighty. We talked about the importance of checking your blood pressure. How can I do that? We talked about at the doctor's office, or maybe at the pharmacy, or at home. What are different options people can do to check their blood pressure?
Yeah, if somebody is if we are trying to diagnose the high blood pressure, or if somebody is already diagnosed and we're trying to manage the blood pressure, we always tell the patients that you got to check your pressure. So. Obviously, when you come to your primary care clinic or your cardiologist clinic, they're going to check your pressure. That's one way you're going to find out. The other way is obviously if patients can afford and if they can get is a home blood pressure monitoring machines. There are certain different machines in the market they can actually use it, which are some of them are validated by FDA, so you can use those. And obviously, if you're outside, if you cannot afford or if you don't have a machine. There's a lot of ways. If you go to Walmart, there's a free way. It's a CVS and Walgreens. They actually give you a good screening, and you can have a free blood pressure check. So there are different ways you can keep an eye on your blood pressure.
Yeah, I know. Like I said, when I was talking with my doctor about my high blood pressure, he recommended just getting one at home and checking that. And also, I think, can you talk a little about the importance of checking it kind of at the same time each day? Because I remember my doctor kind of talking about that.
Yes, that's important. So we usually tell them to check pressure same time when they're checking every day. And then if you're checking twice a day, usually in the early morning before you're going to work or taking your breakfast, so that's really a good time when you're not under stress, you have a good night's sleep, and that's the right time to check your pressure. And in the evening when you're going to the bed, especially if your doctor is changing your medications, he would like to know about these upper and lower numbers, especially in the morning and the evening. And it's important that you check almost every same time of the day. And it's the other important, the same note is that you need to know how to check that pressure. Number one, your cuff size should be appropriate. It should be 80% it should cover your 80% of your arm on the left side, and you should be sitting straight on your chair. You should not be leaning backward and forward, and your foot, both feet should not be tangled around. They should be relaxed like this. Exactly. So when you're sitting like this, give yourself 5 minutes before you check in when you're sitting like this, and then start checking your pressures, okay? And take 2 readings. And you always take the average of the whole readings after that. So it's very important for even if you're checking at home or even if at doctor's office. This is usually the recommended way that you usually check it, because I have some patients, they're just running getting late for the clinic visit, and they're like running over. So I usually try to tell my staff that give them some little bit time, because that's the natural response of the body. When you're trying to run, your body needs more oxygen, and your pressures and your heart rate can go up.
Right, that makes a lot of sense. Awesome. Okay. What are some treatment options? If somebody is diagnosed with high blood pressure, what are some treatment options for those patients?
First of all, I always start with lifestyle modification. Okay. So what is lifestyle modification? So It includes a lot of stuff. Once you're diagnosed with high blood pressure, your life should be changed as compared to what you are living right now. Number one, you should be very active, okay? You should be doing exercise. If it's aerobic exercise, you're going outside or to the gym, at least 30 minutes a day for 5 days in the week. You should be very active. If you're overweight, you got to lose your weight, okay? Diet is the most important part of it's in there. So as I mentioned, Mediterranean diet, that includes a lot of vegetables, fish, legumes and beans, all that stuff. That actually diet which has high potassium in it, that includes your oranges that you eat and bananas that can have it, and low fat diet, okay? So we call it like a DASH diet, dietary supplement to reduce the blood pressure, or Mediterranean diet. So your diet has to be improved, because if you keep taking that extra salt on top of that and low potassium diet, then that's going to be a problem with that. If you're a smoker, you got to think about that. You got to stop smoking with that. And after these lifestyle modification, the next step then it comes with the medications. There are a lot of medications in the market. They've been there for many years. You can weigh, every patient is different depending upon what kind of other medical problems they have. So we can pick up from those medications and start treating them with the medications. If they have a high cholesterol, we need to treat that high cholesterol too. So it totally depends which stage of the hypertension you are. If you have elevated blood pressure, which means that more than 120 systolic but less than 130, you might not need a medication. This is the right time to tell that patient that now this is the right time you need to watch your diet and exercise, because if you touch the stage 1, then we might have to get more aggressive. And of course, nobody wants to take medications. So it's the right time to scare your patients and tell them, hey, I'm going to put you on a lot of medications then. And then medications is something, especially if you're young, and I know that, and probably you know that too, taking the young patients especially is not really good taking meds. So that's something, depending upon that stage, you can pick up your medications and what medications are you gonna use. And obviously you gonna keep follow with that. And if you have a secondary hypertension that is because of the thyroid, because of some tumor, because of some blockage in the major aorta, then you have to obviously treat those conditions too on top of those other medications. And especially patients with chronic kidney disease and those who are on dialysis, they are always at risk.
Okay, yeah, I understand that. So, okay. Alrighty. Well, to wrap this up, when should maybe somebody talk to their doctor about high blood pressure? Can you talk a little about that?
Yeah,
So?
I think every time.
Okay.
Whenever you are going for your annual screening exam, and that's where the important part of the screening is. The word screening does exactly means that you got to go to your doctor, primary care doctor, and get screened for all these conditions, your cholesterol, your blood pressure, for diabetes, and especially at certain age, if you're above 30, 35. So every visit, they should focus on your blood pressure and see, to check your blood pressure in the clinic. If your blood pressure is normal and every year it keeps coming back normal, absolutely fine. And if you have a strong family history, then obviously you have to be more vigilant with that. So I would like to tell my patient that every time you see any provider, they check your blood pressure. That this is the right time to actually check it, because if some healthcare provider is able to see your numbers and give you more guidance that if it's persistent or not persistent.
Right. Yeah. So, well, and as we said, there's not always symptoms. So
yeah, exactly. It's a screening. You gotta catch it.
Right. Yeah. Making sure you're checking that regularly. So, alrighty. So, well, Dr. Burke, thanks again for coming on the podcast with us and talking about high blood pressure. I know I learned a lot today. Thanks for tuning into The Scope. If you liked our show and want to know more, check out phelpshealth.org.